We're going to go through a whole series of body areas here, beginning with the lateral thighs, and in this case we extend the liposuction onto the buttocks and up onto the lower part of the hips also. And the most important principle that Gerhard and I will give you today is to suction in the long axis of the body whenever possible. And the reason is because the nerves and the lymphatic vessels and the blood vessels are oriented in the long axis of the body, and if you suction parallel to them, you'll damage them much less, and the patient will have a much better recovery. Now, Gerhard, this is a powered cannula, and all of these cases that we're going to demonstrate are going to be done with a powered cannula. And the size of the cannula in this case looks to be about 4 millimeters in diameter and perhaps 30 or even 35 millimeter or centimeters in length. Is that correct?
That's correct, yes.
So here we're using the powered cannula, and this is a much nicer experience for the patient. The fat comes out much easier. It's a much easier operation for the surgeon also.
There's not a big difference to the manual-driven cannulas, except that the cannula itself moves additionally to the manual movement, and it vibrates up to 4,000 to 5,000 swingings per minute. So per second it's about an additional 60 strokes, minor strokes, which then will clear up the tip of the cannulas, and it's not irritating the tissue as much as you would do it purely manually. And you see that when you look at the tubing, there will be no air bubbles, and there will be a continuous fat flow. Plus the heme is limited to a lesser amount in comparison to a manual or a normal manual case.
So what you're seeing here is the fat being suctioned in a fairly deep plane. The tunnels are parallel to the long axis of the body for the most part, and you see multiple hands in the field here. This is Dr. Sattler's manual stabilization technique, and the reason for this is because as the fat is removed, some of the tumescence is lost, and in order to maintain the firmness of the tissue, the multiple hands are used to stabilize the tissue, and it just makes things work much better. Here we're pinching. For what reason?
Well, to see how much fat has been removed subcutaneously, and especially we want to take care that not too much fat has been taken just below the dermis, and we have to cover about 1 to 2 centimeter to have a smooth skin appearance after the wound healing.
So here we're suctioning on the lateral thigh and the upper buttock because these areas are continuous.
Yeah. And as you have noticed, the patient has turned around. So we started in a side position, and now this is a prone position.
And this is one of the real advantages of liposuction utilizing tumescent local anesthesia, the fact that you can ask the patient to move multiple times during the procedure. When liposuction is done under general anesthesia, it takes 4 grown people to move a patient during the procedure. So how many times do you think the patient gets moved during a liposuction procedure under general anesthesia? Hardly ever, hardly at all.
Maybe once or twice. Now this patient turns constantly, and furthermore, there's not only the moving of the patient, he also can tense the muscle. So if you have a firm ground to work on, plus the nurses are stretching the skin, you have a very determined fat removal.
So the patient, in terms of positioning, is on their side, Gerhard, and the legs are straight?
Yes. Absolutely. And the toes are pointed. Yeah, because it gives a different positioning again. And so if the knee and the toes are pointed, then the trochanter rotates to the back, and is not interfering then the counter pressures from inside with the fat removal.